My name is Dr. Muhammad Ali, and I am a practicing physiotherapist. And today, the topic of discussion is sciatica, and I am going to be elaborating it according to the latest research, according to the latest literature, according to the latest journal. So, I am quoting it from the journal named as Physiotherapy Management of Sciatica by Raymond Ostelo. I'm not going to talk about the basis, the definition. I'm going to talk about today about the approach as a physiotherapist, that what should we look for and what are our priorities if we encounter a patient with sciatica. So let's talk about the symptoms, the diagnostic procedures, and the treatment respectively. In this way, we'll learn about the latest protocol, what the world is following, what the world is currently following, rather than using the traditional methods to deal sciatica in our physiotherapy clinic. So let's talk about the symptoms. The most latest research. I am quoting it from research from the year 2020. So it is a recent one. Let's talk about the symptoms. The primary symptom is dominance of leg pain more than the back pain, meaning that the leg pain exceeds than the back pain. And as we know that because of the disc protrusion, the sciatic nerve is compressed. So we have to distinguish that whether the pain of the leg is greater than the back pain. That's the first symptom. Second symptom is location of the leg pain, whether it is radiating below the knee or rather it is radiating above the knee. This way we can differentiate it well and correspond it to sciatica. The third thing is weakness or reflex changes in myotomal distribution, meaning that the affected leg would have some sort of weakness, such as loss of muscle strength. We should be looking for the muscle strength, and there is an important symptom that says in the journal that there will be loss of dorsiflexion of foot, right? And lastly, last but not the least, there will be paresthesia or sensory loss. So we have to look into these symptoms to properly investigate sciatica, and we might not be accurate until we have achieved our diagnostic procedure as well as the other tests, special tests, which approves that it's a sciatica. So with respect to diagnostic procedures, the journal says that there are two important tests which are definitely to be used in case of sciatica, and that is SLR, straight leg raise, and the second one is cross straight leg raise. Both of these tests are indicative of sciatica, and they are likely to be used in a physiotherapy setup and a physiotherapy clinic. Now, I'm not going to be talking about the details of the diagnostic procedures because mostly a physiotherapist for a sciatica or a patient with compression of sciatic nerve, the patient is referred from a physician or the patient is diagnosed mostly. But in case if the patient is not diagnosed, I discussed symptoms and diagnostic procedures, the basic one, to understand, to have an overview that how does sciatica looks like and how do we proceed. Now let's talk about the treatment. The journal says that if the symptoms are greater than 6 to 8 weeks, The first protocol, this is an important one. You have to listen to this. Advise the patient to stay active. What does that mean? Advice to stay active is based on a systemic review, based on another research. And why are they suggesting to stay active? Because according to the research, the bedridden, the bed rest is not recommended. According to the data, patients who were more active, who were more into home exercise, who were not sedentary, who were not living with a sedentary lifestyle, they controlled their symptoms and they were improving a lot with respect to the symptoms of sciatica. So the first thing is advice to stay active. The second thing is with respect to treatment, because eventually we are going to be switching to exercise. So we have to advise the patient for a supervised exercise. There is a difference between exercise and supervised exercise. Because in case of supervised exercise, we'll be targeting those problems which are prioritized. And the ultimate goal, as you know, in sciatica is to relieve the patient from the pain. So what are we going to do? We're going to be supervising the exercise, which includes strength, directional strength exercise, motor control exercises, nerve mobilization. But to specify any of these exercises, the data is inconclusive. According to the journal, there is nothing in the literature that suggests us that we should be focusing on only this exercise or that exercise. They discuss a whole plan of exercise, like we have to distribute different kinds of supervised exercise, as I told you about the directional exercises, the strength training exercises, the motor control exercises, and the nerve mobilization. So there is no specificity. The data is inconclusive. But according to the Danish guideline, they suggest that in case of sciatica, we should be using spinal manual therapy. We should be looking into spinal manual therapy because the high velocity impulse or thrust applied at the synovial joint are very beneficial. They are pain relieving, and according to the systemic review, they prove to be a very good indicator for relieving pain in sciatic patients. But there is a opinion that differs from spinal manual therapy, and that is the Dutch guidelines. The Dutch guidelines opposes spinal manual therapy based on another systemic review. But overall, the treatment is based on kinesiophobia. Sorry. The fear of movement. We have to eliminate the fear of movement in the patient. That is why I told you earlier in the treatment guideline that we have to advise the patient to stay active. We never suggest a patient to bed rest and to not engage in the exercises that could provocate his pain. No, we have to advise the patient to stay active. And with respect, now lastly I have to talk about the medication, because mostly medication is a placebo. To be honest, medication is a placebo in case of sciatica, because according to a systemic review, medications such as non-steroidal anti-inflammatory drugs, corticosteroids, antidepressants, anticonvulsants, muscle relaxants, these are the common medications used for relieving pain. these are small benefit, and with respect to these medications, only NSAIDs, non-steroidal anti-inflammatory drugs, are beneficial for the sciatic patient, but the literature suggests that there is no or only a small effect of on pain relief. So what do we conclude? We conclude that the protocol should be very clear. The protocol for sciatica should be based on the provocative symptoms firstly, and then the two major tests which we are going to discuss about it, which we discussed already, that is SLR and cross straight leg raise test. And eventually about the treatment, I told you about the treatment. The important thing in sciatica is never to suggest the patient to stay bedridden. Always advise the patient to stay active. That is the conclusion of today's discussion about sciatica. I hope this discussion was beneficial for everyone, and I will also mention the journals link in the comments, and if you have anything to add, you can just type in the comment. Thank you and have a nice day.